I'm Kim Charniak, and I work with the STARS program, and that stands for Specialized Treatment for Anxiety-Related Symptoms. And what we really wanted to do with that is spell STARS, because what it does is work with kids that need to be brave and courageous and work through their anxiety. And they really are the stars of the program, so we really wanted to highlight that. The ages that we typically see in STARS are 3 to 18. Some of the things we would work on through STARS would be anxiety, OCD, specific fears. We would work on things like Tourette's or tics, or other repetitive behaviors like trichotillomania or excoriation. Some of the ways in which people would be introduced into the STARS program would be through intake, and then the intake worker said, oh, you would be great in this program. So that's one way. And then the other way would be they would work with their provider, and their provider would say, hey, there's a specialized treatment that maybe we could go and do first, and then you could come back to that provider. I think one of the things to know is that we use evidence-based therapy. We use a combination of cognitive behavioral therapy, really looking at how you think about things, how that is interpreted in your feelings, and then how that changes your behavior. So we look at that, and then we also look at ERP, which stands for Exposure with Response Prevention, which means we are going to try some of the things that normally make us worried, but we're going to do that in a supportive, kind of gradient way, and so we can practice it and we're not as worried as we were before.